Yeah. So usually when you take, let us take, there are two important organs. One is respiratory, kidney. So these are the two things which will balance each other. Now suppose they have to give the compensation when it is, suppose if there is a primary respiratory. So when there is a primary respiratory, what will happen when there is acidosis?
Ma'am, sorry to interrupt, but your voice was cracking very badly. I think there was technical network problems.
No, my network is 5G here.
Now I can hear you.
Yeah, I am saying the same way. Can you reduce slide? No, most of the slide is going out of picture for me. Can you hear me?
Yes, ma'am. Now I can hear you.
Okay. So the primary disorder, suppose if it is respiratory, it is compensated by the renal by increasing the bicarb. So there is increase in the bicarb. If it is acute, it will not compensate that well. But if it is chronic, it will compensate. So the maximum compensation for acute will be about 32 of bicarb, and the maximum compensation for chronic will be around 40. So this is one thing. Then suppose if it is a primary alkalosis, respiratory alkalosis, then what will happen? The renal reabsorption of bicarb will come down, and naturally the PCO2 will go up. So that, I mean, PCO2, the bicarbonate will go up. So this is the two things which you have to remember. And that will again have some sort of a upper limit, acute and chronic. So in that, what will happen? The acute bicarb will be about 12 to 20, then and chronic will up to the same, almost same it will come. Whereas an acute respiratory acidosis will be around 32, and the chronic one will almost go up to, many times we see even up to 45. Okay. So this is the how they will compensate. Next slide. Next. Taking too long to.
Ma'am, actually the video is getting stuck. That's why it's not getting reflected.
What reflected?
When I'm changing the slides, you're not seeing it immediately because the video is getting stuck.
Okay. What can we do? Can't do anything, no?
Yes.
Okay, you go off to the next slide. It's okay. Next slide. So in the acute disturbances, if there is acute respiratory acidosis, patient pH will shift around 0.08 units, and there's not much of a compensation. Whereas in chronic, there is a shift of little more, and there is a little more compensation. As I told, the bicarb will be going up to almost 40 or even 45. So that is what one has to remember if it is acute or chronic. Next slide. Yeah. So these are the few formulas which all of you should remember to the rest of your life. Whenever you see any ABG. So these are the four formulas for the respiratory acidosis and alkalosis. So now in acidosis, you all have understood the bicarb will go up, right? The bicarb will go up to counter the respiratory acidosis, which is the PCO2, which is going up. So what is the PCO2? The regular PCO2 in the ABG minus 40 by 10 is the upper limit of bicarb. So that is the formula one. If it is chronic, the PCO2 may be higher, but it taken longer time. So by 3 is usually, these are the formulas made. So you have the formula and then see whether it is compensated or not compensated. Then acute respiratory alkalosis. Here you have to see whether what is happening to the bicarb is, you have to minus it from. Here you have plus, and here respiratory alkalosis is minus. So there, to say the regular PCO2 is normal 40 minus the PCO2, which is low, and that by 4 and 2 for acute and chronic. So this will give the degree of compensation. Once you know the degree of compensation, has it compensated or not compensated? Is it acute or is it chronic? So these are the 4 rules of the thumb which everyone has to keep in mind. Whenever you see an ABG, you have to see what is it? What is the problem with him? He came with some problem of a COPD. What do you expect? The PCO higher. So if it is say 70 minus 40 will be about 30. 30 by 10 is 3. So 25 plus 3 will be about 28. So is the acute, this is an acute or chronic or only chronic? If it is chronic, by 3. So you have to see, add that to 25, which is the normal BICA, then you see. So once you see that, you know whether it is compensated to an extent or not compensated at all. Then you can say respiratory acidosis, uncompensated. Respiratory acidosis, partially compensated. Usually you don't say completely. Usually they call it partially compensated respiratory acidosis or partially compensated, alkalosis, respiratory alkalosis. So these are the 4 formula which are important. Okay. So let us go to the next slide. So here just imagine there is an 18-year-old female in the emergency department. Chest X-ray is okay. Respiratory rate is very high. ABG is showing pH is 7.5. That means it is alkalosis. And what has caused this alkalosis? Is it bicarb? Bicarb is 21. So it has not caused the alkalosis. What is PCO2? PCO2 is 25. So this is the one which caused the bicarb. PO2 is normal and all the electrolytes are normal. Next. So what has happened for this young girl? Maybe she was very, acutely worried about something or whatever it is. So compensation to a great extent is occurred. So, but it is uncompensated to a certain extent. So it is uncompensated acute respiratory alkalosis because she was having a problem, maybe a stress or whatever it is. It was something. The rest everything is looking normal. So that is what one has to do. Okay. Next. Next slide, please. So the other case, if you see, a 65-year-old man is evaluated for marked obesity. So when you are, and he has got hypertension and also, obesity. The chief complaints are shortness of breath. So ABG on room air, pH is 7.33. So it looks a little lower, 7.34. Okay, it is lower. PCO2 is high. So it is respiratory acidosis, it looks like. PO2 is also low. So maybe is also hypoxic. And the bicarb is 30. So 30 means it has gone up. So whenever there is respiratory acidosis, your bicarb will go up. So when you calculate that one, it is a obesity, and for a long time he is having hypertension and obesity. So that is why he must be having a little sleep apnea, all these things. It is causing some chronic respiratory acidosis. So that is why you have got is consistent with some partially campus. So you expected bicarb. What is it? You have to add 25 plus PCO2 is, how much is PCO2? Is 60 minus 40 by 3. So that will be almost coming about 31, but it is not there. So it is only about, the bicarb is only 30. So it is partially compensated respiratory acidosis. So that is how you have to do it. Okay, next. So this is very easy for all of you. 30-year-old, insulin-dependent, diabetic patient with polyuria, thirst fever. So already made the diagnosis. Most probably diabetic ketoacidosis, and is not poorly with the medical therapy, not compliant. It's febrile, conscious, deep respirations, 20 to 25 per minute, dry mucous membrane, red fruity odor. So already made your. So in the ABG, pH is 7.6. So what does that mean? It is acidosis. PCO2 is 16. So it is not PCO2 which has got. So we have to look at the bicarb. Bicarb is 7. So it is a metabolic acidosis, whereas the PCO2 has gone down to 16 millimeters. I'll come a little later. For metabolic acidosis also, we have got two formula. So the whole thing depends upon these 6 formula, 4 for respiratory and 2 for metabolic. Next slide. So what is the H is acidotic, pattern is low bicarb and low PCO2 are typical of metabolic acidosis. Clues are hyperglycemia, glycosuria, ketonuria, they all indicate diabetic ketoacidosis because of the ketoacids. Okay. So the anion gap is usually you have to calculate. If it is, potassium and, your sodium, under the chloride minus, so about you get about, say you are getting about 25, supporting a diagnosis of a high anion gap. So high anion gap metabolic acidosis, we'll come to that a little later because I talked before the things, before I went to the metabolic, I talked about this case because it came in that way. Then also we can calculate the other ratios. Next slide.
Ma'am, can you hear me?
Next slide.
Ma'am, is the case scenario for next slide or you want me to move further on?
Not changed.
I think it's taking time to reflect.
Okay, doesn't matter. You go to another side. Not the I don't want the scenarios. You go away to the other things. Okay.
Sure, ma'am. Sure, ma'am.
Okay, I'll tell. Okay. You go to the next one. Why is it taking so much time for me?
Ma'am,
So
can you
that's
see
why I
the
don't
slide
like
now?
this online. I can see the slide, but you go to the next one. It doesn't matter.